focus of our work in the community right now with our Cancer Wellness Program is a result of funding from Michigan Department of Health and Human Services awarded us a $35,000 Health Innovation Grant. And that grant was matched by our employer for $35,000 by Mary Free Bed. And we also received an $18,000 award from the Mary Free Bed Guild Fund to get this launched. So our focus here is exercise, but looking at the whole person. And many of our cancer survivors that were referred to us either for the inpatient or our outpatient therapy program said, we really need to know more what we need to do to stay healthy. Our medical director of our cancer program is Dr. Chris Vandenberg, and he has been very supportive of the work that we're doing to really make this an innovative program. And so in our vision of putting together a cancer wellness program, we wanted to make sure not only was it healthy physical activity, it was healthy nutrition and focusing on other healthy lifestyle factors that patients could modify.
Yeah, we're very interested in making sure that we are assessing and looking at giving interventions in nutrition, exercise, and quality of life. And those are very key important pieces to a cancer and wellness program. It's interesting to watch the people that come into the program, and as we start to work with them, as they gain knowledge in these areas, to find out what they didn't know and what they end up finding out as they go along, and how to give it to them in a very useful package.
Research has shown us really will make a difference in the lives of cancer patients, cancer survivors. And there's been a plethora of research in that area by multiple cancer organizations and research clinicians.
We researched them all, and the three that we chose was PARmed-X, which was for the quality of life, the nutritional component, again, that is just an assessment that's determining their overall health. And then we have the exercise component, which was where we are going to test their height and their weight and their blood pressure, and then 2 exercise tests. And all those 3 components is when we will test them at the beginning of the program, 12 weeks, 3 months after, and then 6 months.
One of the forms that we use is a PARmed-X, which is highly used in Canada. And what it is it's a PAR-Q, which is a physical activity readiness questionnaire embedded in a medical history and a medical clearance form. And so the patient actually answers some parts of that themselves as a pre-screening. They then take that form to their physician. The physician looks through that form, which has a number of questions on it related to their present health status, their previous health status, particularly as they may have had some cancer treatment done prior to joining our program. And then they go ahead and give that individual medical clearance to participate in that program. We also developed a medical history questionnaire that we use in addition to that, because as you're using standardized tools, they might not actually dig deep enough into the medical needs of a special population group. So we benchmarked with a number of cancer programs across the country and looked at what they were using and worked with our advisory council and worked with Lori very specifically to dive in and see what we felt that we needed to get a good snapshot of those individuals, both for what they're going through right now as well as what they've gone through in the past.
6 of the nutrition sessions, I should say, are cooking classes, food demonstrations conducted by a master's prepared holistic health nutritionist and a natural food chef. And they get all the recipes and they get a lot of wonderful knowledge.
And then we'll again assess them on these same measures at the end of the program. This form is called the F.I.T.T plan, and this is a new tool. And this tool is, we just added this one, and this is kind of more personalized. So again, a sheet where they can have and see and compare from the beginning and from the end of the program. So it kind of just talks about how frequent they exercise, what type of exercise they do, how long they exercise, and then our hope for this is that if they have questions, this is where Terry would come in and answer their questions. This is where, because right now there's not a lot about exercise for individuals, and so we want this to be available to them, and we want them to ask more questions.
The best answer for that would be when, for an example, when the plan is expanding, we're going to go into different populations in different areas of Grand Rapids, and it helps to give them a good foundation for specific populations, so that when we go in, we'll be able to know exactly if there's barriers. For an example, if we are in an area where there's lack of transportation, we'll know that, okay, we're going to need to provide, we'll know the barriers, and then we'll be able to address them.
A lot of practitioners don't realize how important the issue of functionality is to our patients. And it's important to our, so I have patients on both sides of the hospital. I have patients who are truly seeking treatment here, and I also have employees who are our patients. And when we talk functionality, a lot of individuals don't realize that directly impacts a person's quality of life, their person's well-being. And when a practitioner starts to understand that, yes, blood pressure is important, and yes, you being able to, get this much of flexibility in my body is important. But once they start to look at it more globally, and they're looking at functionality, and they're looking at how that affects well-being and quality of life, then in my opinion, a practitioner is able to step up to the next level of patient care.
So what function changes they have is kind of like their new normal. But in the rehab world, there's a lot we can do to help them adapt to that and actually be able to optimize their functional level and their well-being. And nutrition and other healthy lifestyle changes are key to that as well. Well, we were somewhat limited because the focus was to really launch it at one site in our community. So the benefit to doing it at Gilda's was Gilda's draws people from all over, which is good. But having looked at our data to date, we have enrolled 2 cohorts. We have a morning session and an evening session in both cohorts. We've enrolled a total of 62 patients. We've had 12 people attrit from both of those cohorts for various reasons. But so we really have maintained a good rate that have completed our program. And looking at the demographic, what we see is the vast majority, over 84%, are white Caucasian. We've had roughly about 3.2% that's African American, and about another 3.2% that's Hispanic. So we clearly know when we look at our demographic for Kent County, because it's the area we're primarily drawing from, we may not quite be matching that split, but that is a target for us as we go out to other sites when we expand our program beyond our grant period. We also have looked at the age, we've looked at the types of cancers that they have, and it's really all over the board on that. Many of them are breast cancer survivors, but we have patients who are colorectal cancer survivors. I don't think we have anyone that's hematological cancer. They're more solid tumor types. The vast majority are female, but we've had a couple of brave souls, both in our morning and evening sessions in both cohorts that are males. We have a father-daughter combination in this cohort right now. The daughter is the support person. She also is a non-cancer patient, but is a support to her father. We've looked at zip codes, and most of them are from affluent areas, but there are a few that are kind of like in fringe areas. Some are from While they're from a more affluent zip code, that zip code also reflects a rural-urban population mix. So there are different factors to consider in that regard. Our hope is that we will expand to other sites in the community, and we will identify those areas where we have facilities where we can take our program to that. It's critical that we have access to a teaching kitchen, and so we are looking at expanding this to like faith-based institutions as well, hopefully working with area athletic facilities, YMCAs, and Ottawa County in the Spring Lake area. And our goal is really to bring people that have an interest in expertise in this area together and form an actual West Michigan Cancer Wellness Coalition. Another key goal is to be able to take these outcomes and show the impact of this program over time. Because again, we're measuring at baseline at 12 weeks, 3 months, and 6 months. Right now, this program is free to the participants.
So, I think the opportunities for that are limitless. And we also understand that the more that we can get this into the hands of other professionals that would like to move this forward, the better we would be able to serve populations that might not be able to actually go to a highly functional fitness center or a hospital or things like that. I think what I see as one of our greatest challenges is getting this type of program to the people that need it. We do have some affluent individuals who are engaged in the program, but we also have folks that may be more at risk, may have more need, and might not have those financial and life resources to be able to get involved in this kind of program, but yet they need it. They truly do. And so I think that's so important. So I think that's one of our biggest challenges, is to be able to grow this program and grow it at the rate that we want to be able to reach the need in the community.
I think that the greatest thing that I've learned is that they were saying collaboration is we're working and connecting with so many different people in the Grand Rapids community.
They love it. They really love coming to class, and they're hungry for more. So there's definitely a need for this program, and that's again why, like Lori said, the program needs to grow, because people are ready and they want more.